So good afternoon everyone. First of all, thanks organizer for giving me the opportunity. So today we will be discussing about slightly rare issue, a prospective trial of structured exercise program to lessen fatigue in patients with advanced prostate cancer undergoing ADT. So we know metastatic prostate cancer needs long-term therapy with ADT, and it can cause multiple side effects like sexual dysfunction, lack of muscle strength, increased fat, effects on cardiovascular, bone mineral density. So lot of hot flashes, gynecomastia. So these are the long-term effects we see with ADT. Moderate exercises including 3 or more hours of aerobic activity weekly with resistant training and weight-bearing exercises are suggested who are on androgen deprivation therapy. So structured exercise program has been studied in number of trials as a way to prevent or ameliorate ADT related complications. So overall there is a good evidence that exercise can provide benefit for muscle mass and strength, cardiorespiratory fitness, fatigue and declining physical function. Though there is a less robust evidence for exercise induced improvements in bone loss, prevention of falls and fractures, sexual dysfunction, anxiety and depression. So this was the poster session which was presented by Huntsman Cancer Institute by Dr. Benjamin Morgan. Coming to the background, cancer related fatigue, one of the most significant issues affecting quality of life. It is seen in around 75% of men with advanced prostate cancer, those who are on androgen deprivation therapy. So by intervening with exercise, it can serve as a tool to improve fatigue in these patients. So this trial examined the effect of structured exercise program on how to improve the fatigue in men who are on ADT. So this was the prospective trial. Enroll patients with advanced prostate cancer treated with ADT based regimen. It was a 12-week exercise program, that's around 3 months at a single institution. That was at Huntsman Cancer Institute, United States. So patients with at least 4 out of 10 tiredness, self-reported sedentary lifestyle, that is less than 90 minutes per week exercise, no evidence of disease progression and no chemotherapy within 3 months were the eligible for this study. So patients, coming to the methods, so patients underwent peak aerobic capacity, muscular strength and endurance testing before and after 12 weeks of structured guidance exercise through the institution based exercise program that's called POWER program, personal optimism with exercise recovery. So participants completed symptomatic questionnaires including the 7-item promise, that is patient reported outcomes, management information system, fatigue at baseline as well as after 6 weeks as well as after 12 weeks. So patients had 45 to 60 minute supervised sessions weekly, either it was in person or virtually, and were instructed to work up to 150 minutes of moderate activity, and 2 resistance training sessions were given weekly. So the primary endpoint was change in the fatigue. So a 4-point reduction in T-score was taken as clinically important difference. So the secondary endpoint was change in the relative peak aerobic capacity, that is measured in ml per kg per minute. Mean and 95% Gaussian confidence intervals were also reported. So total 119 patients were taken. Out of them 92% had metastatic disease, and the patients were enrolled between 2018 and 2022. 9 patients were withdrawn from the study and 10 were lost to follow-up. So we had 100. Out of that 28 participants lost to follow-up due to COVID. So only 72 patients were available for this study. 96% were white population, 83% were married, 52% had at least a college degree, and 25% were currently employed. So the mean age was 70.3 years and the mean body mass index was 30.5. 24% were receiving treatment with ADT alone, and the rest were receiving a combination of ADT and targeted therapy. So none of the patients were on the chemotherapy. So either ADT alone or ADT plus targeted therapies. So the primary endpoint was done in 72 patients. So there was a clinically significant reduction in fatigue. Which was the primary endpoint, almost 5.1 points were reduced, which was 56.7 at baseline, and after 12 weeks it was around 51.4. So the primary endpoint was achieved with the marked reduction in the fatigue of around 5.1 points. So coming to the secondary endpoint, which was the aerobic fitness assessment, again there was an improvement in aerobic capacity around 3.1 ml per kg per minute from baseline to 12 weeks. So which was baseline was 27.5, and after 12 weeks it was 30.6. So after 12 weeks again both the fatigue as well as the aerobic capacity has improved. So coming to the limitations, so it was a single institution study which was done at one center. So there was no internal comparison group. So the power program, it was a hospital based program. It might not be applicable to independent efforts by the patients. So many, almost 28 patients were lost to not taken because of COVID issues. And so that was the conclusion. So completion of 12 weeks supervised exercise program led to clinically significant improvement in fatigue and peak aerobic exercise capacity. So these findings support routinely recommending exercise for and examining symptom management in patients with metastatic cancer to improve quality of life. Thank you.